A new study is ringing alarm bells about the impact of the pandemic on the mental health of children. British Columbia's children's watchdog and researchers at Simon Fraser University found a pattern in previous public health crises. As Nadia Stewart explains, if the medical system doesn't deal with it now, there will be consequences later.
We've been saying for a long time that there's an inadequate child and youth mental health service system.
In an effort to better understand just how the pandemic is affecting the mental health of children and youth, British Columbia's representative for children and youth teamed up with researchers from Simon Fraser University.
Recall SARS and H1N1. There were studies done on the impact on children, including children who had to be isolated or quarantined and what happened to them.
Add to that research on the impact natural disasters have on children, and it paints a troubling picture of how much their mental health requires urgent attention.
In looking at those past studies, we were able to put together data really clearly showing that we can expect to see significant increases in certain mental health problems for children.
One study involving 369 North American children affected by SARS and H1N1 found 30% exceeded the clinical threshold for post-traumatic stress symptoms, compared to just 1.1% for children who did not have these experiences. About 33% of kids who'd been through quarantine began using mental health services, a much higher number than the 6.8% of children and youth who were not in quarantine.
Is it mostly social? Is it mostly psychiatric? Is it functional?
In September, Dr. Quinn Doan also set out to better understand the pandemic's impact on kids. While we await those findings, what is already clear is the need for more support, especially since what was there pre-pandemic was inadequate. Children, particularly those of Asian and Indigenous descent facing racism, are being disproportionately affected. Charlesworth says the data will help as she makes the case for more funding and targeted solutions.
This research is very helpful to us in terms of understanding not only the scope or the magnitude of the challenge, but also what are the kinds of things that would be affected, because these are treatable and they are preventable.
Nadia Stewart, Global News, Vancouver.